So we'll continue with the topic. So in the previous video I had studied, we studied about definition, causes and symptoms of spinal cord injury. So now we'll see what is the diagnosis that we have to do in order to confirm which spinal cord injury. So we'll go with CT scan of the spinal cord should be done. Okay, CT scan of the spinal cord should be done, and then myelogram it is done. Myelogram is nothing but X-ray of the spinal cord by using dye. Okay, X-ray of spinal cord by using dye. Then spine X-ray will be done. Okay, then spine X-ray will be done. So these are the diagnostic measures that we usually do in order to confirm spinal cord injury. So what are the diagnosis we do? It is mainly CT scan of the spinal cord, then myelogram, that is X-ray which is taken along with dye, and then spine X-ray is done. So this is usually about this diagnostic evaluation that do. And one more diagnostic test that we do, it is urodynamic studies. Okay, we just go with urodynamics studies. So these are usually the diagnostic tests that usually we do in order to confirm with spinal cord injury. So what are the diagnosis we do? Spine X-ray, a myelogram, CT scan, and then urodynamic study. So this is about this diagnostic evaluation that we do. So next is management. So when we talk about this management, the first thing that we go, it is mainly includes both medical management will be there also, as well as surgical management will be there. Okay, so the management when we go, so both medical management as well as surgical management will be there. So in case of this medical management, we start with first is respiratory management. Okay, we start with respiratory management. In the symptoms I have told that they will be having breathing difficulties. If the person is having breathing difficulties, then we have to go with respiratory management. So what is the thing that we do is that we have to, this respiratory management is done, mainly the goal of this respiratory management is to correct pulmonary and cardiovascular functioning. Okay, so this is mainly to maintain pulmonary and cardiovascular functioning. So in case of this respiratory management, we will go with providing them oxygen therapy, tracheostomy will be done, or we'll be giving them ventilation will be done. So this is usually the management that you do in order to correct pulmonary as well as cardiovascular functioning. So we started with diagnosis. I have told you like CT scan, MRI scan, CT scan, spine X-ray, myelogram, urodynamic studies will be done. So next we continue with management. So what is the management? Management mainly includes medical management and surgical management. When we talk about this medical management, we start with respiratory management. So respiratory management, it is done mainly because in the symptoms I told you that the person might have breathing difficulties. In case of cervical injuries, okay, in case of cervical injuries, that is neck injuries, the person might have breathing difficulty, and this breathing difficulty occurs due to paralysis of breathing muscles. So in that case, what we have to do, we have to go with this respiratory management. The goal of this respiratory management is to correct pulmonary as well as cardiovascular functioning. The goal is mainly to correct pulmonary as well as cardiovascular functioning. So this is usually done like by giving them oxygen therapy, or tracheostomy will be done, or ventilation will be done. Okay, or ventilation will be done. So this is usually about this respiratory management. So next is medications. When we start with corticosteroids, okay, we give them corticosteroids, especially like methylprednisolone will be given, or dexamethasone will be given. Okay, methylprednisolone will be given, or dexamethasone will be given. So this is usually given to reduce the swelling that may damage. This is mainly to reduce the swelling that may damage the spinal cord. Okay, that might damage the spinal cord. So normally this methylprednisolone, okay, this methylprednisolone succinate is usually given. So this usually should be given 8 hours. Okay, 8 hours of immediately. It should be administered within 8 hours of the injury. Okay, so this methylprednisolone succinate should be administered within 8 hours of the injury. Okay, it should be administered within 8 hours of the injury. So that is usually done. It should start with a dosage of it should be started with a dosage of 30 mg per kg. Okay, it should be started with a dosage of 30 mg per kg, and it should be given for 15 minutes. Okay, it should be started for a dosage of 30 mg per kg for 15 minutes. So after 45 minutes period, okay, after 45 minutes period, so the dosage can be given like 5.4 mg per kg. Okay, it can be given a dosage of 5.4 mg per kg for 23 hours. Okay, it should be given for 23 hours. So the next is medication which we give, it is corticosteroids. Corticosteroids like dexamethasone will be given, and methylprednisolone will be given. This is given mainly to reduce the swelling that might damage the spinal cord. So in this mainly we give was methylprednisolone succinate. So this should be administered administered within 8 hours of the injury, and it should start with a dosage of 30 mg per kg for 15 minutes. After 45 minutes, after gap of 45 minutes, okay, after a gap of 45 minutes, The dosage can be given about 5.4 mg per kg, and it should be continued for 23 hours. Okay, it should be continued for 23 hours. So the next management that is usually we do is immobilization. Okay, that is usually traction will be, spinal traction will be recommended. Okay, spinal traction will be recommended to immobilize. Okay, to immobilize we go with using spinal traction. Okay, we use spinal traction. So that like skeletal traction will be used. Okay, skeletal traction can be used like Crutchfield or Gardner well tongs. Okay, so that is Crutchfields or Gardner well tongs will be used to immobilize the spine. Okay, to immobilize the spine. So next is that usually we go with is immobilization, where spinal traction will be used to immobilize. So normally we go with using like skeletal traction, that is Crutchfield or Gardner well tongs will be used to immobilize the spine. So it is usually done. So this is mainly they will bring a proper alignment of the spine. Okay, they usually, this when it is used, it will give a proper alignment to the spine. So that is usually done. So next is supportive therapy. Okay, so the next thing that we go with is supportive therapy. So that is mainly to reduce the other symptoms that is usually there, like pain, to correct bowel and bladder, like to improve bowel and bladder control. Okay, to improve bowel and bladder control. Next usually like to improve sexual functioning. So all these things usually we go with giving medications. Okay, we go with giving medication. So that is mainly supportive therapy. It is mainly to reduce the other symptoms. Okay, it is mainly done to reduce the other symptoms such as bowel and bladder control, to maintain bowel and bladder control, to reduce pain. So normally we go with giving Botox injections. Okay, we go with giving Botox injections in the muscles, so that usually reduces the pain. Okay, we just go with giving Botox injections in the muscles so that it reduces the pain. Okay, it is usually reduces the pain. Then we can go with physical therapy. Okay, then we can go with physical therapy to and also can you go with physical therapy, so that can control the pain. So this is about the supportive therapy. Supportive therapy usually we start with supportive therapy. It is usually started with like reducing the symptoms like pain, correct the bowel and bladder control. So all this thing it is usually done. So normally we go with Botox injections to reduce the pain, as well as physical therapy is usually done. So this is about this medical management that usually we do. It is mainly first is respiratory management will be done. Next is medications will be given like corticosteroids, and then immobilization will be done, and the last is supportive therapy. So now next we'll move on with the surgical management of the spinal cord injury. So in case of the surgical management, so normally there are two major surgery which is usually done in order to correct the spinal cord injury. So the goal of the surgical surgery, it is mainly to reduce this pressure on the spinal cord. The goal of this spinal cord injury, it is the goal of this spinal cord surgery. Okay, the goal of this surgery, it is mainly to reduce pressure on the spinal cord, to reduce this pressure on the spinal cord, and also to stabilize the spinal cord, So this is the goal of this surgery. It is mainly to reduce the pressure on the spinal cord and also to stabilize the spine. Okay, to stabilize the spine. So surgeries that we perform, it is laminectomy and foraminotomy. Okay, so it is mainly performed, it is laminectomy and foraminotomy. So laminectomy, it is usually surgical removal of the bone that will decompress the spinal cord nerves. Okay, it is mainly surgical removal of the bones that usually decompress the spinal cord nerves. Okay, that usually decompress the spinal cord nerves. Laminectomy, it is nothing but surgical removal of the bone to decompress the spinal cord nerves. The next is foraminotomy. Foraminotomy, it is usually they will enlarge the area. Okay, usually they enlarge the area around the bones. Okay, they will be enlarging the area around the bone so that it can relieve the pressure on the compressed nerve. So normally surgical management, so it is mainly done. The goal of this surgery, it is mainly to reduce the pressure on the spinal cord and also to stabilize the spine. So this is usually there are two major surgeries that is usually done. So it is mainly laminectomy and foraminotomy. Laminectomy, where they will be removing the surgical removal of the bone. It usually decompresses the spinal cord nerves, and foraminotomy, it is usually done. It is usually where it enlarges the area. Okay, enlarges the area of the bone so that it can relieve pressure on the spinal cord. So this is about this management. So management mainly includes medical management and surgical management. Understood? So in this video we had studied about spinal cord injury. So what is spinal cord injury? Spinal cord injury is nothing but injury which is usually begins with a sudden traumatic blow on the spine that usually leads to fracture or dislocation of the vertebrae. Causes, it might be same to the head injury and brain injury, like fall, accidents, vascular diseases, infectious diseases, motor vehicle accidents, any assault, gunshot injuries, and spinal cord tumor or ischemia due to occlusion of the spinal cord, spinal blood vessels. This is the causes. Symptoms, I have told you, it might be different for cervical injury, for thoracic injury, and as well as for lumbar injury. Diagnosis, CT scan, MRI, CT scans, X-ray and myelogram. And then management, I have told you, medical management, respiratory management will be done, corticosteroids will be given, immobilization will be done, and supportive therapy is usually done. And surgical management, mainly they go with laminectomy and foraminotomy. Laminectomy, it is nothing but surgical removal of the bone to decompose the spinal cord nerves. Foraminotomy, it is enlarges the area around the bone so that they can reduce the pressure on the spinal cord. So this is about this spinal cord injury. So understood? Please refer the video and I'll also send you the notes. Please do study whatever we are sending. Thank you.